With all the talk in recent years about concussions, maybe you've heard of something else. It's called a post-concussion syndrome.
Upper cervical misalignment can complicate that diagnosis and even lead to a misdiagnosis.
Dr. Drew Drummond is here to explain how, and he returns from Spinal Balance Health Center. Good to see you, Doctor.
Hi,
Thanks
Dr.
for stopping
Drummond.
by.
Good to be here.
Welcome back.
Concussions,
Thank you very much. Yes.
Hot topic right now. What are you seeing from your end?
We'll get people in with a number of symptoms that are related, what people think are related to concussions. When people come into my office, they'll have headaches, neck pain, dizziness, fatigue, all those common things that would come from a concussion. But in reality, they come from a misalignment at the top of the neck. And they have sometimes both happening at the same time. I'll talk to my patients and say, well, did you have an accident or an injury? And almost every time they will have an accident or injury, remember, and some of the times they'll have a concussion. So I would say the upper cervical misalignment is really more common than the concussion, and they mimic one another.
But maybe they think they just have a concussion because it's such a hot topic.
Yeah.
I mean, we're seeing it in football and all over the place.
Yeah, it's probably become such a hot topic simply because of the media attention to it. We've got movies on it now with Will Smith. We've got NFL players dying over time, and it's little concussions over time that are leading into the problems that we didn't know about before. So it's not just a matter of getting your bell rung. It's serious.
So at Spinal Balance Health Center, you don't treat the concussion, more the misalignment.
No. So I've actually got a picture of what happens before and after an injury. On this picture on the left shows what a head and neck should look like. You should have a straight up and down head and neck and a horizontal atlas. And then after an injury that causes or doesn't cause a concussion, either way, that trauma can cause the head to tilt. It can change the relationship between the top bone of the neck and the head. And it starts interfering with the autonomic nervous system, the sympathetic nerves, the parasympathetic nerves. And then that leads into headaches, fatigue, irritability, neck pain. And those are exactly the same symptoms that people would see from a concussion.
So as a patient, how do you know what you've got?
It's really difficult because if you get a concussion, if you're out playing football or if you're in a car accident and there's a concussion, you're immediately shuttled to the emergency room. And then you're in a medical model that deals with the concussion. And it's more of a chiropractic or upper cervical chiropractic model that then deals with the cervicogenic symptoms. So there's not a lot of bridge in between the two. So the patient is then forced to have to figure it out on their own, and if they don't find the upper cervical doctor or the person that's going to fix the atlas, then they're kind of left out in the cold, and sometimes they'll deal with symptoms, migraine headaches for 10 years.
Wow.
And they'll come in and wonder, why hasn't I told about this? And there's just not enough communication.
But the example in that picture, that head tilt, was fairly significant, but maybe not as noticeable in some people, so it's probably harder to diagnose.
Yeah, it doesn't have to be that severe. Sometimes you can look in the mirror and you can see the neck is off, the head is off. Other times there is no head tilt. So the only real way to know that if it's happening is to come into somebody like me and have me look at your posture. But if you have all the common symptoms, you have an accident in your past, you have head tilt, it'll affect the muscle tone of your back muscles. So if you have shoulders that are uneven, low back pain, neck pain, all these things kind of lead people down the pathway that they should be coming into an upper cervical doctor.
Even though upper cervical care is not new, it is going to be new to a lot of people watching. So what does when you're adjusting a patient, what does that procedure entail?
Well, to come into my office, first there's an upper cervical exam that we do, which involves x-rays. So we'll take 3 x-rays, one from the side, one from the top, and one from the front, and it gives us a 3-dimensional view of that bone. You can see me here digitally analyzing the exact misalignment of the atlas, and then we mathematically calculate how that bone was misaligned and the force needed to bring it back into a better position. And then after that's all done, it's a very gentle hand adjustment where a person is lying on their side, there's no pain involved, and then I stand over the top of the patient, and with a very, very gentle correction, we just apply a force into the neck that moves that bone back into the right position, and then the symptoms go away. The nerve interference stops.
It's not painful.
No,
right?
No, it's definitely not painful. Most people get up and they wonder if I did anything. I go through a lot of educational process in my office explaining to them exactly how it's happening and why. Otherwise, it just almost seems impossible that that light of a force could do anything.
After a serious trauma to the head and the neck, are there any contraindications for adjusting that bone, the atlas?
Not a lot. If there's a concussion, obviously you need to deal with the immediate situation first. You're not going to get a concussion and come directly to me. You're going to go to the emergency room. You're going to be with the people that are dealing with the brain trauma. But after that, aside from the atlas being fractured or something of that nature, there's not a lot of contraindications because it's such a gentle adjustment that we do. It's not a thrusting force that we're putting into the neck. It's very light. There's not a whole lot. But I'm trained to recognize red flags to say, don't adjust this person way too.
We're talking concussions today, so you might notice that head tilt or the headaches, but there are other symptoms for that misalignment of that bone in the neck. So what are some of those symptoms?
When you start affecting the autonomic nervous system, I've seen digestive problems come from an upper cervical misalignment. Low back and neck pain are very common because it affects posture. Any of the weight-bearing joints, problems swallowing, tinnitus in the ears, sinus issues, heart palpitations. The whole body is controlled through the nervous system. So when you start affecting a central part of your central nervous system, like where your atlas is at, then it's just unlimited on the things that can go wrong.
Yeah, and that's why you could have digestive issues because of those nerves.
Yeah, I just had just somebody yesterday came into their office. We adjusted him last week, and this week his acid reflux is better. So
No kidding.
yeah, it happens all the time.
Acid reflux.
And we've heard countless stories here on the Morning Blend. I encourage you to go to our website and search Spinal Balance, and you'll be able to see Dr. Drummond's past visits, a number of them with patients who talk, I've had fibromyalgia or migraines and nothing worked until this.
Yeah, you definitely don't have to wait for a concussion to treat your upper cervical misalignment.
But it's interesting to see how all of this relates, and people who've had concussions or dealing with these other symptoms years later, and upper cervical care ends up working for them. We've got a special offer, Mike.
Well, we've had those viewers, our viewers have come in, they've taken advantage of this special offer, and they've then come on this show to talk about the symptoms that were affecting them and the treatment options that you provided and the relief. And so the first 15 people who call Dr. Drummond's office are going to receive a consultation, exam, and x-rays for only $50. And you know x-rays are expensive, so that value of $50,
do we need to tell you,
that's
Dr.
a good value,
Drummond?
doctor.
No, it's a good deal. It's very low risk.
The number to call to take advantage of that offer, it's 402-452-3400. And if you'd like to learn more about the Spinal Balance Health Center in Millard, go to spinalbalancehc.com.
Dr. Drummond, good to see you.
Good to see you
Thank
too.
you.
Thank you very much.
Thank you.
Thanks for having me.
Appreciate
Well,
it.
Caribbean cruising.